Hi, everyone. Welcome back to another Brainstem video. My name is Kristen. I'm also here with Emma and Madhu, and we're going to be talking about astrocytomas today. So to get us started, let's talk about some background terms that might be helpful to know. So what is a tumor? What does malignant mean? And what are the four lobes of the brain? Essentially, a tumor is a mass or growth of abnormal cells. So you can think of them as visible lumps on your body, but they can also be inside your body. And tumors are growths of like cells that kind of get out of control, and brain tumors are growths of abnormal brain cells. Malignant means cancerous. If you think about gas in a car, malignant means that the gas is going to places outside of the engine. So cells that are normally in one part of your body can invade another part of your body. And this is what causes cancer. For the four lobes of the brain, we have the frontal lobe, the temporal lobe, the parietal lobe, and the occipital lobe. The frontal lobe is right behind your forehead, and it's in charge of thinking, planning, and making decisions. So basically all of your cognitive abilities. Your temporal lobe is on the sides of your head, next to your temples, and it's important for memory and hearing. Your parietal lobe is toward the back of your head, and it's important for managing your five symptoms or senses and other sensory information. And your occipital lobe is important for sight. Now, moving on, what is an astrocytoma? So an astrocytoma is a type of cancer that begins in the brain or spinal cord and develops from glial cells. Astrocytomas are malignant, meaning that the tumor cells have the ability to break off of the tumor body and spread to other parts of the brain and the spinal cord. Kind of as an interesting note, other cancers like skin cancer or breast cancer can spread to your brain, but brain cancer, especially astrocytomas, will not spread outside of your nervous system. And like I said, it develops from glial cells, which make up the supportive tissue of the brain. They're kind of like the skeletal structure that help build your brain. Astrocytomas are divided into four grades, 1 through 4, and these grades signify how abnormal the cells look under a microscope. Under grade 1, there's three types of tumors that are big, long, fancy words. You have pilocytic astrocytomas, pleomorphic xanthosarcomas, and subependymal giant cell astrocytomas. We're going to be talking more about these three types later, so don't worry about what they mean right now. But essentially, grade 1 tumors in a microscope, these cells look the least abnormal, and they don't extend very far into the brain tissue, so usually they can be completely removed with surgery. Grade 2 astrocytomas are called diffuse astrocytomas, and they're going to start to invade the brain tissue a little bit more and be harder to remove with surgery, so chemotherapy is often necessary to treat these tumors. Grade 3 tumors are called anaplastic astrocytomas, and they're qualified as a lower grade, like 1 or 2 astrocytomas that develops to be more malignant and more cancerous. So they're going to be much more aggressive and need much more aggressive treatment, and surgery is never curative. You always have to have a second type of treatment with these tumors. And then finally, grade 4 astrocytomas are called glioblastomas, and you guys have already learned about this. And so if you'd like to learn more about these, please reference our glioblastoma video.
Okay, now that we know what astrocytomas are and how they're graded, the next question is why and how do astrocytomas develop? There's two main reasons. They can either be caused by hereditary syndromes, which are genetic mutations, or environmental causes. So let's talk about the first reason. Hereditary syndromes caused by genetic mutations. Do any of you guys remember what genetic mutations are? Have you learned about that or talked about it in your classes? Basically, genetic mutations are changes to your genetic code, the DNA that encodes your genes and makes up who you are. There's a bunch of different ways that genetic mutations come into effect, and there's different types, but you'll learn about that in your other classes. And a few different types of genetic mutations that can cause astrocytomas. They have very difficult names, but there's Li-Fraumeni. It's a mutation in the p53 gene. This regulates cell growth. So essentially, you're no longer regulating cell growth, so your cells are growing out of control, and this leads to cancer. There's also a Turco mutation. It's a mutation in other tumor suppressor genes, like the APC and the MMR. And again, these are genes that suppress tumors. So when they're mutated, they can't suppress tumors, and that's what causes tumors. You can also have neurofibromatosis 1, which is a mutation in the NF1 gene, also a tumor suppressor gene, so similar to the others. You aren't suppressing the tumors, they're growing out of control. And finally, tuberous sclerosis. This is a rare genetic disorder that causes mental disabilities and early onset of SEGA. SEGA is a grade 1 astrocytoma. So these are just a few types of hereditary syndromes that can cause astrocytomas. The other main causes are environmental. So ionizing radiation, this is like X-rays or protons. So when you're exposed to ionizing radiation, especially at a young age, then that can cause you to develop an astrocytoma later on in life. One example where this might happen is if you're being treated for leukemia as a child, especially, and if you have radiation, especially to your head or neck, because that's in the same region, this is where astrocytomas develop, and you'll be more likely to develop them later on. Okay, now we have to ask who. So who develops astrocytomas? Interestingly, grade 1 astrocytomas are more common in children and adolescents, which is abnormal because in general, cancers are more common in older patients. But overall, patients over 40 tend to be most affected for all other astrocytomas besides grade 1. Also, older patients are more likely to have a higher grade, which makes sense because typically as tumors progress, as they've been there longer, then they become a higher grade. And grade 3 and grade 4 astrocytomas are slightly more common in men than women, but that isn't, it's just very slight.
Now I'm going to be talking about the where portion of astrocytomas. So I'm going to be covering the affected areas of the brain and the associated symptoms. So astrocytomas can grow anywhere in the brain. And because of this, the symptoms that they cause can vary widely. Generic astrocytoma symptoms include headaches that won't go away, they get worse in the morning, or they can even wake the patient up at night. So you could also have double or blurry vision if you have an astrocytoma. You could have speech problems, decreased thinking abilities, weakness in the legs, arms, or hands, and seizures. So these are all like associated symptoms if you have an astrocytoma. Okay, so going back to grade 1 tumors, pilocytic astrocytomas are the most common in the cerebellum. So does anyone know where this is or what it does? I'll let you pause the video to answer. So in addition to the more general symptoms of a brain tumor, these tumors can also cause difficulty walking or balancing, clumsiness, sleepiness, and even premature puberty. So pleomorphic xanthoastrocytomas are common in the temporal lobes, and 70% of children with these tumors will have seizures. Hemiparesis is also something that can happen, which is weakness on one side of the body. So SEGAs typically grow in the ventricles. These are fluid-filled spaces deep inside your brain, and these are here to provide cerebrospinal fluid to the rest of your brain. You can think of them like wells that provide water to a home, for example. So these tumors can also cause a hydrocephalus, and this is a buildup of fluid in the skull. So apart from this, the symptoms are pretty similar to generic tumor symptoms.
All right, finally, we're going to be talking about when. So what is the timeline for when you have an astrocytoma? So firstly, when you get an astrocytoma, you're going to have the symptoms. This is how these tumors are recognized. So kind of like Matthew was saying, you might have really bad headaches that wake you up at night. You might have seizures, or you might have premature puberty. And so when you have these symptoms, you're going to go to your doctor, and your doctor is going to investigate. And astrocytomas are diagnosed very similarly to other brain tumors. There is another video on this that you guys can go reference, but in general, brain tumors are diagnosed with an MRI, which is magnetic resonance imaging. Then we move on to treatment. So like many other brain tumors, astrocytomas can be treated and they can be cured with surgery. It's important to note that surgery is almost always the first step for treating astrocytomas because a multitude of reasons. It can give the doctors a sample of the tumor cells called a biopsy, which helps them develop a good chemotherapy or radiation treatment. It can provide an opportunity to remove as much tumor as possible. So even if you can't get all of the tumor, it helps to remove as much tumor as possible because it's going to reduce your symptoms. And it can make chemotherapy or radiation more effective. And then finally, like we said earlier, grade 1 tumors can often be cured with surgery. So it's better to start with surgery before you move on to other effects like chemo and radiation, because if you can get it all, why not? Finally, astrocytomas that cannot be cured with surgery are treated with chemotherapy and radiation therapy and other specialized drugs and medications. We're going to go into this in our treatment video, so you guys can reference that if you want. But one special treatment for astrocytomas that is unique is called tumor treating electrical fields, which is when a special device is applied to the patient's scalp and it emits electrical waves that can slow the tumor's growth. You can kind of think of this like microwaving an ice cube. So the electronic waves slow the tumor's growth or melt the tumor and make it so it shrinks a little bit. Finally, prognosis, or how long do these patients live? It depends on the type of tumor. So grade 1 tumors are usually cured with surgery. In 96% of patients, they live at least 5 years. They usually live a very long time if this tumor is cured. For grade 2 tumors, average survival is 8 years. There are certain gene mutations that can lead to a longer survival period, but in general, you survive for 8 years. With grade 3, the average survival is 3 to 5 years. And finally, with grade 4, average survival is 15 months, which is just over 1 year. So in conclusion, we have some review questions for you, and you can pause the video to answer these among yourselves, or you can ask your teacher. But what are some differences between the 4 grades of astrocytomas? Can you name 5 symptoms that may result from an astrocytoma? And what is the first step in the treatment process for astrocytomas? Thank you for watching our video, and please be sure to check out our YouTube channel for more brainstem videos.